Hello, you're watching Health Day now. I'm Mabel Jong. The last few years have brought to light existing cracks in the U.S. healthcare system, particularly when it comes to addressing mental health needs. Exclusive data from the National Action Alliance for Suicide Prevention in a Harris Poll survey, a partner of Health Day, shows that more than 84% of adults say that as a result of the pandemic, it is more important than ever to make suicide prevention a national priority. In an effort to reach more people in distress and connect them to help faster, the old clunky 10-digit suicide prevention Lifeline was replaced in July with an easier to remember 3-digit number, 988. The simplicity of dialing just 3 numbers could be life-saving. At least that's what Cal Beyer believes. Raised in Wisconsin, 61-year-old Cal suffered periods of despair throughout his teenage years. His family was open about its history of mental illness and loss of family and friends to suicide. Cal remembers making his first call to a crisis hotline when he was 15 years old. Joining us now is Cal Beyer, a member of Action Alliance's Executive Committee, to share his personal experience with calling that 988 Lifeline. Cal, it is so great to see you.
Thank you, Mabel, and I appreciate your interest in this topic. It's really important.
Well, thank you so much for your time. Let me ask you, you have used a crisis lifeline in the past. Can you give me a little bit of background on that?
Yeah, I grew up in a family of 5 children. My parents sat me down when I was 12, let me know that mental health challenges ran on both sides of the family tree, to not be embarrassed, and that help was always available. And they told me, we have good health insurance, we'll find access, never be embarrassed, and don't be ashamed. I shared with my parents a couple years later that I was going through some tough times, and they listened to me, they provided guidance. I still was a little bit stubborn, as probably most teenage students. But in the end, my mom gave me contact information for a hotline in my hometown of Madison, Wisconsin. I believe I was 14 or 15 the first time I made that telephone call. I didn't talk about it a whole lot, but it was life-changing for me.
Wow.
And I encourage people to make those types of calls all the time.
What were you hoping, or what should others hope for when they do dial that lifeline?
I think the most important part is for people to feel safe, that there is someone there for them. So it's very important that we continue to fund services like the National Crisis Lifeline. So there are more users. Call volume after July 16th expanded significantly. I was really happy to hear that the response time had decreased. But I think that's really important. It's hard for a person to make a call.
Can you tell me what that experience is like when you dial the number? What is the other person saying as soon as they answer?
It wasn't so much, honestly, what was said, it was how it was said. It was calm, it was reassuring, it was friendly, it was hopeful. Those messages are the things I remember more than what was initially said. It put me at ease. It made me feel like, okay, I'm not alone. This person cares. I'm going to have someone I can talk to about my challenges. Those are the things that I remember. That's many years ago, if you think about it, when I was in high school. And the feeling that gave me, again, was a person as a guide in the woods, in the darkness. They had the flashlight. They were guiding me through scary times. Then it was the message of, you know, I care. We care. There are people here, you know, and it was unnerving. I think for me, I was used to being in control or pretending to be in control. I had to give up a little bit of control to trust another person. And I never felt judged. I never felt like I was a burden. It made it easy for me to have that conversation. When they said things, I'm sorry you feel this way. I'm sorry you've experienced this trauma. They understood how that could feel. They offered me resources. They talked to me about finding a counselor. They knew people I could call. who had experience with adolescents, it just gave me hope that I wasn't having to fight this, battle by myself.
Cal shares that he's made several calls to crisis lines over the years, but in his 20s, he learned coping skills that helped him manage his mental health. Now he supports others through his job as an executive focused on workforce risk and worker well-being, and as an executive committee member of the National Action Alliance for Suicide Prevention.
I teach companies nationally how to take care of people, how to build a caring culture so they can talk about workplace mental health.
To further discuss the national impact of the 988 suicide and crisis lifeline so far, I'm pleased to have Colleen Carr here. She's the director of the National Action Alliance for Suicide Prevention. Well, we generally think about people calling crisis lifelines for themselves, but lots of times a friend or relative is calling on behalf of a person who needs help. 83% of survey respondents said they would be interested in learning how they might be able to play a role in helping someone who may be suicidal. Colleen, how is dialing 988 helping?
Having 988 as an easy to remember 3-digit number is really helping to decrease barriers to reaching out for help. We want people to call the crisis call centers that the country established, and it really is an intervention in and of itself. And so our call centers are staffed with trained staff and volunteers that know the communities they're working and living in, and are a first place to go if someone is needing help.
What about the people and resources like therapists, hospital resources, um, mental health programs, and beds? Do we have enough of those to support the need? Or does it vary state by state?
We have a lot of work to do around increasing our workforce and decreasing barriers to access to care. And what we found in some public perception polling that we did recently is that more and more Americans see suicide and mental health as critically important. 92% of US adults perceive mental health as equal to or more important than physical health. But only 51% feel as though we're treating physical health as mental health as important as each other. And so while there's increased awareness and recognition of the importance of mental health, we have a long way to go to ensuring that our systems are accessible. And so we know there's both a lot of work that we need to do with the health force that we have today in training them in mental health and suicide prevention, but that we also need to be looking to the future and to the future workforce and really building capacity and addressing some of those systemic barriers. As the data shows, people are willing to reach out for care, and we can't ignore the systemic barriers that still exist around access to quality mental health care.
When a person calls 988, what happens from there?
A trained crisis counselor answers the phone, they listen to the caller, and they understand how their problem might be affecting them, provides that support, and shares resources if needed. Um, if for some reason a local call center is not able to take the call, what we have built more recently is there's been an investment in our national infrastructure. And so the caller is then automatically routed to a national backup crisis call center.
Now, two-thirds of survey respondents report facing a barrier to reaching out to crisis services. Some of the top barriers include fear of out-of-pocket costs and fear of law enforcement responding. How do you hope that these barriers will be addressed in the future?
For far too long, there wasn't an adequate crisis response system in place, and so public safety was the default. And so part of what 988 and the transition to 988 has offered is really an opportunity to revisit what crisis response does look like and should look like in communities, and really ignite a national dialogue around how we want to be responding and supporting individuals in crisis. And in most cases, that's moving away from a public safety response and moving towards a mental health response. And so it's really exciting to see both the recent attention to 988 and our national call center infrastructure, and increasing attention to building community response like mobile crisis services, alternative crisis supports, diversion from public safety, and then for those who need a higher level of care, making sure that they are able to access higher level services.
So we're talking about a feeling amongst some communities, especially in Black and Hispanic American communities, that perhaps the crisis response, the police involvement or involuntary trips to emergency rooms or psychiatric hospitals, that might be part of the response in the past. But you believe that the national conversation is trying to move the response away from that.
Absolutely. And the primary goal of the Lifeline has always been to provide support for people in suicidal crisis or mental health related distress when they need it and in a manner that's person-centered. And out of the millions of calls that they do manage, fewer than 2% of Lifeline calls require a connection to emergency services. And so while there are some rare cases where safety and health issues might warrant a response from law enforcement, the goal is really to provide care and stabilization in the least restrictive manner. This change of phone number that took place in July is really the beginning. And I think it's incumbent on us to make sure that the attention stays on mental health and suicide, and that we recognize that the investments made over the last year are critical, and that no matter where you live in the US, that you have access to supportive, compassionate crisis services that are led by mental health during your darkest times.
What is the advice you would give to people who are thinking about dialing 988 today?
Don't wait for a crisis to happen. Make the call when you first feel isolated, rejected, alone. Don't wait for a crisis. Reach out. It's a lifeline. It is hope. It is help. And it's always available. It's free. It's accessible. It's confidential. Help is available.
Our thanks to Colleen Carr, Director of the National Action Alliance for Suicide Prevention, for speaking with us today, and to Executive Committee member Cal Beyer for sharing his story. I'm Mabel Jong. You've been watching Health Day Now.